We've been getting calls here at 11 Alive this week about long lines at COVID testing sites. Some sites closed earlier during the spring and summer as the spread of the virus slowed. Now a new wave is driving that demand back up.
In tonight's Voices for Equality, our Caitlin Ross talked with a local doctor who helped develop an at-home antigen test, and she's hoping it will ease some of the lines and help people disproportionately impacted by the virus.
Put the drops in.
Dr. Patrice Harris can walk through how to take a home COVID test in less than 5 minutes. The patient gets on a video call with an eMed proctor. They swab each nostril 5 times and then put the swab on the test strip. 15 minutes later, they show the results to the proctor. Those results are then sent to the patient's local health department.
We want to make sure that tests are equitably accessible to everyone. And we want to make the right thing to do, the easy thing to do.
Dr. Harris developed the home COVID test with eMed and Abbott last year after people were waiting for hours to get tested for COVID-19. And she says she's starting to see that again.
Just in the last several days, I've seen what I saw early on in the pandemic. Long lines, people waiting in their cars for hours.
As a former president of the American Medical Association, she says it was important to her to make sure everyone has equal access to testing.
Black and brown communities were disproportionately impacted.
She thinks people will start turning to at-home tests more as the pandemic continues, and families and employers need this information.
We are getting a lot of calls from employers who are thinking about return to work testing protocols.
The eMed COVID test is approved by the FDA and can be used to re-enter the U.S. after international travel. More on that at 6.